Hello, my name is Dan Brock. I work as part of our team here at UF Health Shands Hospital on our special partnership with Eastside High School. We are so proud to be in a partnership with Eastside's Medical Skills Program. The program is designed to introduce students to a variety of jobs in the hospital setting. Everyone is familiar with the typical positions at a hospital: doctors, nurses, and scientists. But these jobs are just a few of the countless positions we have here. Our organization employs over 16,000 employees, all of which come from a different personal and educational background. We certainly couldn't take care of our patients without doctors and nurses, but the same goes for the hundreds of people who do the other jobs, like prepare the patient's food, or the transporters who move patients to and from their rooms. We all play a role in providing patient care. The objective of our partnership with Eastside is to familiarize the students with various departments and jobs, to give them on-the-job learning experiences here in the hospital, and to provide training to the students on employability skills. The students' first experience with the hospital setting comes in the form of field trips. We host 2 field trips per year where Eastside students tour our hospital. Our department managers get to meet and interact with the students, while the students get to explore different areas within our hospital. Even after the field trips, our department managers continue their interactions with the students by coming to visit them in the classroom, providing more exposure to the departments and giving them a chance to ask more questions and learn about job opportunities. Our human resources team also sends teams out to Eastside to provide training to the students on employability skills, helping teach the students by conducting mock interviews or practicing filling out job applications. The final phase of the program includes an internship. During the students' very last semester of high school, they actually come to work here for a few days per week. In total, students will have accumulated over 60 hours of on-site training to help them gain experience and practical skills associated with each job. They experience firsthand a day in the life of an employee within that department, as well as gain experiences and familiarity with the department leaders and employees. Ultimately, we want to hire these students directly out of high school. Our goal is to make sure we do our part in preparing the students to be employable at UF Health after graduation. Now, let's meet the leaders of the featured areas in which you may intern and get a sense of what they do every day to help take care of our patients.
My name is Angel Keel, and I work for patient transportation, and I've been working here for almost 5.5 months.
Hi, sweetie. My name is Angel, and this is Jaquez with Patient Transport, and we're gonna be taking you to your CT, okay, hun?
We are basically the working ants of the hospital.
We're just getting her set up to go to CT. We're making sure all of her lines are connected that needs to be connected, and making sure all of her cords are unplugged. We have to make sure her oxygen levels are good before we go. Sometimes we have to unplug the EKG, everything.
We take the patients from point A to point B, and we make sure they get there very safely.
Patients always first. Couple bumps.
And we can transport them in wheelchairs. We transport them in stretchers and also beds. We transport patients to x-rays. We transport them to ultrasound. We also discharge patients, chemo treatments, anything like that. A day in the life of a patient transport can actually be very hectic.
We're giving them the chart back, we're signing the patient in, and then we have to head back down to the ED, and then check the board, and then finish the task.
It is basically nonstop. We can walk anywhere from 6 to 12 miles within an 8-hour span. It is absolutely hectic, but it is completely worth it, and it is absolutely amazing.
Will you let the nurse know that Tin's back on? Thank you, love, I appreciate it.
You have to be very caring.
We hope you feel better, okay? And we hope you heal quick, okay?
Not only do you have to be caring, you have to be social. You're gonna meet different types of people. You have to know how to talk to those people. You have to know how to handle those people.
My name is Angel. I'm with Patient Transport. I'm gonna be taking you to your CAT scan, okay, hon? Okay. I'm gonna go ahead and put this up. And do you mind if I check your wristband? Thank you, love.
Well, you know how it is being in pain. You know how it is not being in the best of moods. You're gonna have to understand how to handle those patients and how to put them in a better mood. And sometimes you're not going to be able to put them in a good mood, and you're just going to have to roll with the punches, and you're just going to have to put a smile on your face and try to make, those minutes or those hours the best as possible. You should consider this job because it's really satisfying to go home knowing that I made a positive influence on someone's life, whether if it was for 5 minutes, 10 minutes, or even 30 minutes. It makes me feel good knowing that I actually helped them out. They looked at me at the end of the day saying, you know what, it was a bad day and you turned it around, and I really appreciate that. There's no other feeling knowing that I really turned their day around.
Hello, my name is Isabella Garboski, and I have been a phlebotomist here at Shands for 3 years, and now I'm going to show you what a day in the life of a phlebotomist looks like. So whenever we first get here, we have to stock up our carts with all the supplies that we will need on the floor as we go visit our patients. These are the tubes that we're going to use to put the actual blood in. And each one is for a different test. They're color-coded, and it tells us on our little device which one to use. This is the complete needle that we will use on a patient to draw the blood from. And then this is where you stick the tubes inside to vacuum it out. So now I'm set to go to the floor and draw my patients. Usually we come out as a pack, like all of our friends that we have made here and everything on the shift with us. We just kind of stick together, and that makes the job more fun rather than just being alone on the floor. We walk all over the hospital. We go to almost every floor here at Shands. We draw anywhere between 30 to 50 patients a day. I have probably walked about 1 mile visiting all of my patients this morning. So these are our devices that we use to scan the patients, and they're called rovers. And whenever we get here for the day, our assignments are on here. So you can see I have a patient assigned to me. That's the one that I have to go draw. Usually there's more. So say I have like 10 patients to start out with, and I'm going on the floor and drawing those patients. Maybe a doctor will randomly put in an order, so I'd have to get that one added on to me since I'm already in the same area, or I can cut down my list and then go help somebody else on their list, and just whatever is assigned to us, that's where we go. So we are about to go in and introduce ourselves to the patient and ask if we can draw some blood from him for the lab. So first, you're going to sanitize before every room. Then you're gonna put on some gloves, and then we're going to get everything else. So I need a needle, gauze and alcohol pad, a tourniquet, and the tubes that the doctor ordered. And then we also need a piece of tape. Hello, Mr. Lee. I'm here from the lab. Is it okay if I draw some blood from you?
Absolutely.
Okay, let me just scan your armband. Okay. Is this arm okay?
Yeah, I'm fine.
Okay. So I'm putting on the tourniquet to make his veins pump up a little bit so it's easier to find and draw the blood from. I'm gonna clean the area. Dry it off.
Is it gonna hurt?
It might feel a little pinch. Okay, here we go.
She got it then.
Yes, sir. We're filling up the tubes with blood. And you take it out, unpop the tourniquet, lay the gauze over, and then he is all done. You have a good day, thank you. So now you have to put his labels on the tubes. And then put them in the biohazard bag. And now it is ready to be sent to the lab. And then you just dispose of all of the dirty instruments in the trash. And sanitize again. And that's it for that patient. On to the next. So it's pretty cool whenever you're meeting these patients for the first time. Most of them are usually gracious of what we do, and they want their results, so they're happy that we're there. And they're really nice, and especially the ones that are staying here for like a week or so, they almost become like friends while you're here, and we just make small talk and everything while we're in there, and it's just a pleasant experience. This is the core lab where we send our specimens to be tested. And then you just leave them there and they do the rest. This is a great job that you can get to get a feel for what it feels like to work in the healthcare world, to see if you would like to go anywhere else. You have fun doing it, you make relationships with everybody that works here, we become a family, and it's a great stepping stone.
My name is Nicole Dix. I have been at UF Health for 10.5 years. I am an admissions training associate. The internship in our department will consist of entry-level positions. So they will assist our front desk clerks. So they will get the paperwork together for the patients to come in the next day. They could also assist our front desk associates with any direct admits.
Hello, are you checking in?
Yes, I am.
So we have patients that the doctors say we need to admit you today. They could either just be leaving clinic or get a phone call. And so then they come over.
I just have a couple of consent forms for you to sign.
Sure.
Just consent to treat you, authorization to bill.
Okay.
And our front desk clerks will have to, they're registering them, and then they're searching for a room. So they can assist with that, with gathering the information for that. They will fax information over to insurance companies, sometimes to maybe primary cares, to help with the process of obtaining authorizations. They can also escort our patients to the floor. So our interns will get a chance to also see the hospital. We have 3 towers that we have admission front desk staff in, and that is our pediatric hospital, our cancer hospital, our heart, vascular, and neuromedicine hospital. There are over 250 employees in our department, and we are spread out organizational-wide. Like, our employees are not just in our admissions department behind the door. We have outpatient, we have admissions specialists in the emergency department, and our inpatient department. We're looking for the intern that is coming in and thinking about entry level, but is willing to stay with UF Health longevity. So they're not just coming in to stay at that front desk clerk. That's a position where they can come in and see what goes on within the organization and kind of see where they would like their future to be. Just like me when I started off as a front desk clerk. And what happened is that I got to see the different parts of UF Health as an organization and was able to get experience in different departments and then figure out where I would like to spend my longevity at. And that's how I became a part of the admissions department. What makes admissions fun and exciting is that we see everything. We see the patients that are coming in for procedures. We see the family that is coming in to support them. We see it all in admissions, and I think that's what makes it very fun and interesting to work in admissions. We have that family environment. It's not just one employee that does a job. We are a department, and we all work together to complete our jobs.
Hi, I'm Jasmine Rollins, and I'm the supervisor here at UF Health in sterile processing, and I've been here for 15 years. Sterile processing is basically we take care of the instruments for surgery to get rid of any diseases or bacteria that may be on them. We make things safe. We make sure everything is sterile before it's used on you. Now I'm going to take you on a tour to Decontam. That is where all the fun and excitement begins. It's where the case cards with the instrumentation that was used on surgery is actually going to be reprocessed. So this is entering Decontam, and as you can see, Terrence, he's dressed out in full PPE, which is your booties, it's your gown, your face mask, your face shields, and most importantly, your decon gloves. This is a case card that just came down from surgery. It has blood and body fluids on there. So once we have scanned everything in, it will come to the sink where it will begin to be rinsed off. If there's any bodily tissue, fluids on there, it will be rinsed and sprayed off in the first sink. The second sink is where it will sit for 15 minutes prior to going over to the final rinse sink. Once it comes from out of the sink for the final rinse, it will then be loaded into the washer, where when the arms are rotating in the washer everything will be able to get hit with lubrication, enzymatic, and water. So we process roughly about 250 to 400 trays a day. So typically, give or take, it's about 5,000 instruments a day that we're reprocessing. So right now we're in our metavator room, which is our scope room, which we reprocess our endoscopes. We physically hand clean them ourselves, and we send them through a machine called the metavator. These machines make sure that they are mechanically clean. So once these scopes are done, they are hung to be dried. Once they are dried, we tube them up and put them into clean bins to take them upstairs to be ready for a case or for an emergency procedure. So now we're on the sterile side to where once the items have left decon, they're gonna come through this washer. The door's gonna open, and that's when we will unload the trays and put them on these carts. And as you can see behind you, we have a tray here that is waiting to be assembled. This tray is ready for assembly. So right now I'm assembling the tray. Then once we go from the sterilization, we will put them into the sterilizers, which we call the big ovens, which get to 270 degrees. So from there, we place them on a sterile cart where we let them cool prior to going to the OR. For me, seeing a patient come out of surgery, going home on the elevator, or see just them coming out knowing that they had a perfectly good surgery, nothing was wrong, there was no issues with their trays, no issues with them, makes me feel really, really happy. And plus with me knowing that I've had relatives that my staff's trays were on, makes me very happy and excited to know that this is my team that did this and I had some part of it.
I need the peanut butter and jelly. My name is Melanie. Now I have to do the teas and get my drinks. I work in the dietary department. I've been here for a year. When you first get here, you make sure you have silverware. That is very important. I like to do mine in the morning. I'm normally early, so I can make sure I have enough throughout the day. They call my position PDA, for Patient Dining Associate. Tony, do we have another tray of lettuce and tomato? And it's a great job. Now we're gonna go in there so we can get the drinks that's on the list. At the computer every morning, you have to look and see how many patients and what their list is, and you print out the tickets, you take them to the front, and you'll go by your sheet to know what you have to have for that unit. We go by the list and get the amount of waters. For example, I have 3 waters that I have to get. You'll see your coworkers and everybody, we running and, getting our stuff together and trying to make sure we be online at a certain time. We're laughing, we have fun in here. Today is the roasted turkey with chicken gravy, traditional cornbread stuffing. I'm gonna make sure we have cranberry sauce over here. Each patient has different diets. We have to put the orange dot for people who have allergies, and some people like certain things, some don't. Oh, I'm getting ready to build the tray. 1, 2, 3. You're gonna have 3 soups. So you have to get everything, and building the tray or getting the right drinks. It's very important that you get everything that's on that list. Grilled cheese is up. Sometimes a new patient ends up on the floor. So if I did have a new one, I would pretty much call the unit and ask them to transfer my call so I can get his selection or her selection to make sure they get something to eat as well. And we go and take the carts up. So this is my unit. Food service, is it okay to come in? And you greet the people and, ask them to verify their name and their date of birth to make sure you have the right person and you're not giving the wrong tray to the wrong person. We have fun, we really do. So it's exciting, and if you give it a chance, you'll see, you will like it, you'll like it.
Hi, my name is James Kelly. I'm a lead stock tech for the Department of Supply Chain Services. I've been here since July of 2018. So what we do, we help supply all the units in the hospital. It can range from fluids to kits to toiletry bags, everything and anything. So it could be range from an ICU, it could be a pediatric unit. It all differs. A day in the life, we usually get supply requests from all the units. add the item ID for that particular item. I go print the label for it. And then my responsibility is to go up to the unit, make the space available for however many they need, place the label, and then let our night shift stock techs become aware that, hey, such and such a unit has added, say, 60 ml syringes. Please be aware, and that if you see the label, please make sure to have that stocked. What intern we're looking for? Day one, be prepared to meet expectations. You do have to adapt and improvise, and if you're able to be willing to do that, that is a major plus for us. We are absolutely vital to this hospital, especially in times like these where a lot of units sometimes they'll call us in a panic, say, hey, we're running out of masks or gloves. That's where we come in and help, and we have to be available at a moment's notice. And anytime, if it's one of the more serious units, whether it be for COVID testing or one of the ICUs that are in need of a supply, we're the first and last line defense pretty much. We always rise to the occasion, and I think that's been a big help and why I like working here.
The benefits of this program, I think, are kind of yet to be seen, but we're super excited.
Some of the feedback that I'm getting from the kids in the program is that they really are excited about going to UF Health and being part of the internship and working with the professionals and learning about the different fields.
It gives the students an opportunity to learn about jobs they've probably never heard of, that they don't understand as even part of a hospital system. If it's not a nurse or a doctor, many students don't know of all the behind-the-scenes kinds of positions that are available.
The kind of student that would excel in this program is one that is very dedicated to being punctual, being on time, talking to people, respectful, willing to make changes, with flexible, happy-go-lucky, a good positive personality, and have a great work ethic.
What we anticipate is that as current 8th graders, 9th graders see the success of this first senior class, that there will be a big demand for, I want to be in that program. I see a future there, and I'm excited to be a part of it.
I really love what I'm doing, and I'm looking forward to the success and seeing the kids out there motivated, working, being part of that job force and doing what they love. And that's my biggest reward from the program.
My name is Ed Jimenez, and I'm the Chief Executive Officer here at UF Health Shands Hospital. You're about to have an amazing set of choices to think about. It's not often that in high school we can have the world in front of us, although people do tell us that. The reality is the partnership between UF Health and our community is strong. Every day, we want our community to get stronger. What that really means is we want every one of you to have a future that's bright, a future where you can make a difference, and a future where you can take care of your family. And so what we're doing is we're going to create this partnership. We're going to show you that there's a career and a profession for every one of you. While we have scientists and doctors and nurses, we have accountants, we have technicians, we have folks that do so many important things. We have 11,000 people in our hospital. We have another 5,000 people in our medical school. 16,000 people do great things. No one person is more important than the other, but everyone can make a difference. Come, join this journey. Have fun with it. And it's a journey because where you start may be different than where you end. My first job was a transporter. Then one day, it all worked out. Thank you for being part of this journey, and go Gators.